Hey, everybody, thank you for tuning in today. Really excited to tell you about our short-term home health care product. Just to give you a little bit of a heads up on it, we have had this product rolling for 3 years now, and it's performing extremely well. And the response from the agents who have been selling it's been great too. So why don't we get into it today, and then we'll tackle some of your questions a little bit later on. Agents that have been selling for quite some time, you know the answer to this question. And it pretty much works with about any type of insurance, whether it's life insurance, ancillary insurance, cancer insurance, hospital indemnity, and even home health care. You know, when are your clients going to pick up the phone and call you and ask for help, specifically today with regard to home health care costs? Well, that's going to be after they have some type of a health event. They find out they're going to need home health care, and we know it's just too late to apply. So we need to take a little bit of time when we do meet with our clients, if it's on an annual basis or when we're setting them up for a special product, talk to them about if they have some exposure to an area like this. And before I even get into the product, the short-term home health care plan, it's not something for just the elderly to consider. This is something that can apply to about anybody. You know, we never know when we're going to have some type of an accident, a ski accident, and blow out our knee or just fall down the stairs and need some home health care. So think about this in terms of a product you would talk to most of your clients about. The main thing is just bringing it up. Now, if you're not familiar with Guaranty Trust, well, we've got some great news for you. We've been around for quite some time, since 1936. We've always been a mutual insurance company. We work in 49 states. We are AM Best rated A- excellent and zero debt on our balance sheets. All of us work out of the main office building in Glenview, Illinois. So if you are ever in the area, give us a holler, stop in, and we'd love to see it. Something that we do with all of our products at Guaranty Trust, we kind of specialize in the ancillary market, and the short-term home health care is no different. And what I mean by that is we always try to create a product that has bells and whistles on it that nobody else has. Even companies that tend to copy our products don't put all the bells and whistles on it that we've been offering all along. So the short-term home health care plan is the one we're going to focus on today. And something that we've tried to do to help you as the agents get the cross-sale started, and most importantly, make your presentation time of our product as short as possible, because we know you're very busy and you don't want to take a half hour to explain an ancillary product. We try to create tools for you guys to use. And I'm going to share with you one very shortly, which has been an absolute success, home run, our consumer cross-selling video. I'll also share with you our infographic. So we're trying to make sure that when you do go to cross-sell GTL, it's easy to bring up, easy to explain to clients, and you have all the tools you need to make it easy to do so. Also, when your clients are ready to apply, we have all different platforms for you to get the business to us. We have an e-app that you can use on Apple or an Android tablet or smartphone. When you use the e-app, it is instantly underwritten and issued after you submit it. So you probably won't make it to your car before your client has their application issued. We also have a PC platform. So if you're not with the client, you can actually do an e-application for them. I'll get into those a little bit later. And then we do trainings like today, thanks to Premier for setting this up to kind of pass along some of the cross-selling tips that we have from agents who are successfully selling the product. So the target market that we found for this is basically if you have clients that are taking prescription drugs, well, I'm sure you guys are rolling your eyes because that's pretty much all of your clients. If you have some clients that really haven't planned for future care, maybe they've reached an age where they don't have a long-term care policy and they can't afford it now, or they can't even qualify for it health-wise. These are all target markets. Another one is a situation like my own. I'm 55 years old. I travel about 22 weeks a year. My wife is younger than me. She travels every week. If something happens to our parents where they need home health care, they need somebody to stay with them, well, my wife or I have to change jobs or make some drastic changes. So somebody like myself, my wife, would purchase this policy, pay for it for my parents or her parents. That's another target market for you. And the great thing about this plan is it's so easy to qualify for. So if you've got these types of clients, these types of target markets, I'm pretty sure they're all glad that you're here today. And why don't I show you the consumer video and let me see what you think about it, because our clients and other agents tend to think it's phenomenal.
There's no bed like your own. And if you suffer an illness or have an accident, the last thing you would want to do is recover in an unfamiliar, hectic environment like a hospital or nursing home. Focus on your recovery in the comfort of your own home with short-term home health care insurance from Guarantee Trust Life Insurance Company. Think about your family situation. You may be reaching that age where planning for future care is necessary, or maybe your parents are reminding you they don't want to go to a nursing home. How could being unprepared for either yours or your parents' need for care affect your finances and way of life? GTL's short-term home health care insurance is more affordable than most other plan of care policies, and it pays benefits directly to you regardless of any other insurance you have. Home health care benefits kick in if you suffer a cognitive disability or can't perform 2 of the 6 ADLs, and no hospital stay is required. The base plan consists of 3 main components, and there are 3 different base plans for you to choose from to match the level of coverage you want. With the home health care benefit, your chosen plan pays a benefit for up to 360 payments for a variety of services, including skilled nursing, physical therapy, and general nursing care. With our most comprehensive plan, you can receive up to $162,000 of home health care benefits. With the home health care aid benefit, you can receive a daily benefit for each day you require the services of a home health care aid, depending on your chosen plan, and no hospitalization stay is required. Most likely, you're taking at least 1 prescription medication. With the prescription drug benefit, you can receive benefits for any prescriptions that are filled after the policy is in effect. Just filling your normal prescriptions can help offset the cost of the policy itself. Now let's see how it works. Say you're 65 years old, have the Plan A policy, and take 1 brand name prescription that you refilled 10 times over the year. A GTL short-term home health care insurance policy would pay you a total benefit amount of $250 over those 12 months. With an annual policy premium of $294.45, the net cost of the policy would be less than $4 a month. And this is not even including any home health care benefits you may receive. Policyholders can also have access to Ask Mayo Clinic services 24 hours a day. Receive personalized support and trusted medical guidance for your health-related questions from the experts at Mayo Clinic. Short-term home health care insurance from GTL is flexible and customizable, with a great set of riders for you to choose from. And with only 2 or 3 underwriting questions, you don't have to worry about a long application process or medical exams. So, for a fair premium, wouldn't you rather receive professional care at home? Now is a great time to find out more about GTL's short-term home health care insurance.
There you go, a really short video that can really get your clients interested in the product. Now, some agents are actually playing this for them during the presentation. Some of them are actually emailing the link to it and letting them know, we need to set up an appointment to talk about this product. So both have been working really well. But a lot of the feedback I do get from agents when I do trainings live is that playing the video at the appointment as a cross sale works really well. So let's have a little bit of fun right now, and we will just qualify everybody on the phone for this product to show you how easy it is to get. So if you answer the first 2 questions no, you get the plan if you're getting Plan A or B. So let's do that. So is the applicant currently in a nursing home, assisted living facility, or receiving home health care or similar type of benefits? If we answer no, we're halfway home. Is the applicant unable to perform routine activities of daily living or cognitively impaired? That's it. If you answer those both no, you get plan A or B. If you want to get plan C, you would answer the next question. And if you answer that no, you can get plan C. So that is actually the only underwriting on the plan. And a couple things that I want to point out, you guys may have already thought of this already. You didn't see any questions on there about, do you have cancer? Do you have COPD? Do you have insulin-dependent diabetes? You didn't see anything on there about anything like that, did you? So I just want to throw that out there. So as we start getting into the product and some of the other riders, you'll notice that, wow, my client could get this and even be having cancer right now as he's applying for it. So something like that, I just want to pass along to you. Okay, so as the video said, there's 3 different plans to choose from. And whichever plan you choose, A, B, or C, there's 3 components that you get. The prescription drug benefit, home healthcare benefit, home healthcare aid benefit. So we have an issue age range from 40 to 85. Something that's great to know is once you have this product, you continue to keep it as long as you pay your premium. So if you buy it and you're 86, 87, 88, it doesn't matter. As long as you keep your premiums, you pay your premiums, you can keep this product. So it doesn't ever go away. So I just want to throw something on your screen, and please don't feel like you need to memorize anything. The only reason that I'm throwing all 3 components and their benefits on the screen at the same time is just to make one point. If you choose Plan A for home health care, you will automatically get Plan A for home health care aid and for the prescription drug benefit. So whichever plan you purchase, you're going to get the same one for all 3 components. So you cannot mix and match plans by components. So let's just go one by one through them all. And let's just start off with that prescription drug benefit. Did everybody on the line catch that when it said in the video, as soon as your policy is issued, you start getting prescription drug benefit? So you don't have to be on home health care in order to get prescription drug benefits from this plan. The only thing you need to do is have an issued policy, and then the prescriptions that you're already taking, you will start getting $10 each time you refill a generic prescription and $25 each time you refill a brand name prescription. And if you get Plan A, you can get up to $300 in prescription benefits from GTL a year. If you get Plan B or C, you can get up to $600 per year. So these are some kind of examples that I can throw at you. The video had a nice one in there, but if you get Plan A, you're 65 years old, you refill 5 brand name prescriptions, 10 generic prescriptions over the first 12-month period of your policy, well, that's going to total $225 of prescription benefits coming to the policyholder from GTL. With that annual premium for a 65-year-old, it's going to be $294 and change. All of a sudden, we look at this, and now this plan costs them less than $6 a month. So this is the way the plan works in terms of the prescription drug benefit. And here's a couple FAQs that I generally get when I'm doing live performances. So let me just handle a couple here. So you're saying, Greg, are you saying that if I just take one prescription and it's a brand name and I refill it every month, I'm going to get $25 a month from GTL, which is going to be $300. And if I had Plan A, I would max out the prescription benefits there and then? That's true. And the same works for generics, except it's going to be $10 per prescription that is filled. Now, this is a very common one that I get. What if I have a client who's on a 90-day supply? Is that going to be 1 benefit or 3? Well, keep it simple. Anytime you get a prescription receipt, the one that's stapled on the bag or comes in the box with your mail order, that's going to be a benefit. So if it's a 90-day supply, they're going to get 1 receipt. It's going to be 1 prescription benefit. So up to the client, you can certainly help them with this. May or may not be worth them converting their 90-day supply to monthly and getting 3 benefits from GTL as opposed to just 1 for a 90-day supply. Most common question I get is, well, what if they have a drug plan already in force and when they go to the pharmacy, it's only a $5 copay for them to pick up their prescription? Or what if it's a $0 copay? Is GTL still going to send them $25 or $10? Absolutely, we are. So this is an indemnity-based product. We are going to give the client exactly the benefits that they have coming. We are not coordinating whatsoever with regard to this plan and other insurance they may have in force. So that's the first component. The second component is the home health care component. Now, something does have to happen to the client after policy issue in order for home health care benefits to kick in, and that could be either them developing a cognitive impairment or a functional impairment. Now, as I mentioned earlier, a functional impairment, that can happen pretty quickly. That could just be, falling down the stairs and breaking your hip or blowing out your knee or something that doesn't allow you to do your ADLs. Or if it could be something more permanent down the line, a cognitive impairment that would make this kick in. Now, something that's super important is to know how long they have home health care benefits for. And that answer is they have it for 360 days of use. The most important thing I can tell you about that is the 360 days has nothing to do with the calendar year. So they could get home health care 360 days in a row and work through that benefit, or they could do it once a week for 360 weeks. So it's not really a calendar limit, it's the amount of days that they have coming to them for home health care, and that's 360. You may be wondering if this restores. Well, I could say maybe, and that's actually a correct answer. With regard to restoration, if somebody uses the plan, whether it be for, if they use it all 360 days, if they recover to the point where their doctor says, yes, you no longer need home health care, and that lasts for 180 consecutive days, then yes, this plan will restore fully. They'll have another 360 days coming. However, if they go on home health care and use it up for 360 days, and it's something that's permanent, something they're not going to recover from, let's just say currently Alzheimer's, there's no cure for that. So this would not restore again. So very simple with regard to restoration. If you do recover and you recovered for 180 days of not needing home health care, this does restore. Now, the most you can, yes. Yeah.
Quick question. So Brian out there is asking, how does Medicare handle home health care? And also with Med Advantage? How do you guys coordinate or not coordinate?
No, great question. We actually don't coordinate at all. So with anything with this product, whether it be the prescription drug benefit, home health care, or home health care aid benefits. So, it's more of just the client letting us know that they are getting home health care and showing us proof that they are getting it, and we will pay the benefits on the screen that I'm about to go over. So we are not coordinating whatsoever with regard to any component on this plan or any rider on the plan. So when we look at Plan A, you see a bunch of different types of home health care that you can get, and you also see a dollar value, and that would be per home health care visit. Now, the most you can get per day with Plan A is $150. So you can have a physical therapy and a speech pathology visit. And if you did max out the $150 per day times the 360 days that you have for this component, that's $54,000 in home health care benefits that's available to the client. If you purchase Plan B, you can see you get a little bit more money per visit, and the most you can get in total per day from Plan B is $300. So the $300 per day times 360 days, $108,000 of home health care. And as the video showed, with Plan C, you can get up to $450 per day. And when you do the math on that, that's where that $162,000 that was shown in the video of home health care benefits is available to the client. A quick example of how this works. Let's say that a person's 65, they have Plan A, so they can get up to $150 per day of home health care benefits. They unfortunately suffer a stroke. So for 10 days, they need to have both a speech pathologist and a physical therapist come to their house to do home health care. And they do it for 10 days in a row. So that's going to be $150 per day that they're getting from GTL to help take care of their home health care costs. So that's $1,500 in 10 days that they have coming to them. And again, that 65-year-old, $294 and change per year in annual premium. That looks like a great investment that they've made in this policy. And we still haven't even considered that they're probably taking some prescriptions and getting benefits from that too. Now, the third component is home health care aid. And I will just generalize this as usually a home health care aide coming to the house to help them with their ADLs. It could be something totally different depending upon what the doctor writes out on the plan of care. But generically speaking, most of the time the home health care aide is coming to help them with their ADLs. So if you have plan A, that's $40 per day, plan B, $80, plan C, $120 per day in home health care aid benefits. Couple nice things, you don't have to have a prior hospitalization in order for the home health care aid benefits to be able to kick in. And if you're wondering how long home health care aid benefits last, it's 60 days. Again, nothing to do with the calendar year. The same restoration applies to home health care aid as we talked about already for the home health care benefits. If you use it up and you recover where your doctor says you do not need home health care aid services anymore, after 180 days of that, you get yourself a full restoration of this part of the plan. So those are the three components. Something that's really important, especially with regard to when I mentioned you could have some serious health issues already and still get this plan. You need to let the clients know that this plan does have a 6-month pre-existing condition limitation. And actually, the best way for me to describe it is an agent phone call that I got the first year. And the agent called up, it was a female, and she said she just got the GTL short-term home health care plan for her husband. And she said her husband is currently being treated for cancer. And she wanted to know how the 6-month pre-ex would work for him. And I said, well, it's really simple. If your husband, since he's being treated for cancer currently, if he needs home health care due to his cancer, within the first 6 months of his policy, he will not be able to use it. However, after 6 months, if he needs home health care due to his cancer condition, he would be. On the other hand, I let her know, well, you know, your husband, if he unfortunately fell tomorrow and broke his hip and needed home health care, he could certainly start using this right away. So the 6-month pre-ex is just for the pre-existing conditions they have and needing home health care services due to those. But there's really no wait to use this if it's something that's not a pre-existing condition. So as I mentioned earlier with the underwriting questions, you could already have some serious illnesses. And if you are not currently in need of home health care or not receiving home health care, and you don't have a cognitive issue or you don't have an issue doing your ADLs, you can get this plan even with some very serious health conditions. So we mentioned this in the video. We have an agreement with the Mayo Clinic where anyone who gets a GTL policy will have access to their online symptom checker. It is quite more advanced than what you would find with some of the other ones you look up online. They have 33 more algorithms built into theirs and many more drill down questions. So if your client's doctor is not in, or it's late, or it's a weekend or a holiday, and they spend a little time on the Mayo Clinic site, they're going to get a much better drill down situation and response with regard to if it's something they really need to go to the hospital and, you know, quickly for, or if it's something that can wait a little bit. It's a very nice benefit. I've used it myself, and it's much better than the other stuff that's out there. So something that's really important with regard to this plan is making sure your clients understand that the rates do not remain stable throughout the entire length of having this policy. About every 5 years, the rates do increase. So let's just do a quick example here. If I'm 65 and I'm buying plan A, I'm going to pay $24.54 a month. Now, when I reach the age of 71 and my policy then hits its anniversary date, my premiums will increase to $32.85 per month. Then down the road, when I hit 76, and my policy hits its calendar anniversary, my rates are going to go up again. So that's the way this plan works. You know, depending upon when you buy it, you may not have a rate increase for 4 or 5 years, or if you buy it at, let's say, age 69, well then, you know, 2 years later, you're going to have a rate increase. Now, I mentioned earlier that you can keep this plan as long as you like. So there is one last rate increase at age 86, and then you see that on your screen. Most clients want to do monthly bank draft, but we can draft for any mode. And if you have somebody who wants direct billing, we do offer quarterly, semi-annual, or annual direct billing. Just kind of remember, if you're going to do direct bill, you're going to do a paper application and send in the first month premium or the first quarterly premium with the application. If you're doing any type of bank draft, you do not need to collect anything. We'll draft the premium upon the effective date of the policy. So that infographic I mentioned early on, this has been something that agents are using 2 different ways. One, you can see on the right page, we've put some area there where you can put a stamp sticker or even take a PDF and type in your contact info. This is a pre-approved consumer marketing piece, just like our consumer video is. Some agents actually use it during the appointment to walk the client through the plan so they can quickly explain what ADLs are, what the home health care aid, and prescription drug benefits are. Very nice piece. You can call GTL to order them. Just tell them you want some short-term home health care infographics mailed to you. Filing a claim, well, I don't know that we could make it any simpler. With regard to getting your prescription drug benefits, the only thing you need to do is take an envelope, put GTL's address on it, put your prescription receipt in there, writing your policy number on it, and mail it to GTL. That's all you need to do. There's no claim form. You just need to send us the receipt or a copy of the prescription receipt. You can send it in as much as you want. We have people who do it annually, monthly, daily, weekly. We don't care. We get them processed. And actually, we have a new AI system that actually processes the prescription receipts. So nobody at GTL really even touches them now. So it's worked out very well, and we're very flexible with regard to how often people can send in their receipts. Now, if you're going on home health care or home health care aid benefits, if you work with GTL at all and ever seen one of our hospital indemnity claim forms or anything like that, it's very short and simple. So they're going to complete the short-term home health care claim form, which basically asks for their policy number, contact info, what type of claim it is, doctor's contact info, and then sign the form. They also sign a HIPAA form, and then they would send in their bill for whatever their home health care or home health care aid was. Now, the first time through starting this claim, they're also going to include their plan of care from their licensed physician, and that's it. After that, the next time they have bills, they don't need to submit a plan of care. They don't need to submit a new claim form. They can just send in the proof of service or the bill. With any of the riders that I'll quickly go over today, it's the same thing. Complete the claim form, send in the proof of service, and that's it. We like to process the claims quickly. We have an 8 to 10 day turnaround time on our hospital indemnity claims. And the same thing goes with the short-term home health care. So clients get their money quickly. They see the plan works. And like I said, we've had this plan rolling for a few years now, and it's been absolutely great. Now, one of the reasons that I mentioned earlier that, you know what, there were no questions on the application about diabetes, COPD, emphysema, cancer, anything like that. We do have a hospital indemnity rider on this. And you know, GTL's hospital indemnity plan has been the market leader for years. But if you do have some of those serious health conditions, you're not going to be able to get the hospital indemnity product unless you're in the guarantee issue window. Well, we already saw the application questions for this product. We know that we didn't have any questions about specific health conditions. So this is an opportunity for agents whose clients need short-term home health care and may want some hospital indemnity coverage to be able to get the hospital indemnity rider. You can choose to get $100, $200, or $300 per day when you're in the hospital. You can choose either a 3-day or a 6-day benefit period. And whichever you choose, the benefit periods restore an unlimited amount of times after 60 days of no use. So hospital indemnity, I know a lot of agents do sell that out there. Kind of keep this in mind that if you do have somebody who can't qualify for a hospital indemnity plan from GTL, you may be able to get them the hospital indemnity rider on the short-term home health care plan. The only caveat that's worth mentioning here with regard to this plan is that, one, there's a 30-day waiting period for sickness hospitalizations, none for accident. And the other one is that, like the base plan of the short-term home health care plan, the rates for the hospital indemnity rider will increase on the same schedule as the base plan, about every 5 years. If you're getting our standalone hospital indemnity plan, Advantage Plus, that one, the rates never increase as the clients age. So good reasons to have this. There's also good reasons to have a standalone hospital indemnity plan, but you guys know your clients, you know which one will make the best for them. There is a 6-month pre-ex on the hospital indemnity rider, and it's the same exact thing I mentioned earlier. So nothing new to discuss here. You buy the plan, you can't use the hospital indemnity rider for the first 6 months that you have it for any pre-existing conditions. After 6 months, you certainly can. There's a nice ambulance rider on it, very inexpensive, about $3 to $5 a month. The nice thing about the GTL ambulance rider, there's really no fine print on it. If you use an ambulance, you're going to get your $200 benefit. We don't care if you take an ambulance for an ER stay, a short observation stay, or a full-blown inpatient stay, or taking it to go to some type of facility. You are going to get your $200. Some of the other carriers out there will not pay you an ambulance benefit unless you're admitted. We don't do that. So $200 when you use an ambulance, up to 4 times a year, up to $2,500 over the life of the policy. And if you use up your ambulance benefit, that rider will then drop off the policy and the premium will go down. Critical accident rider, we get a little older, bones get a little brittler. These things tend to happen. We fall, break our hip, fracture our skull, dislocate a hip. All these things would be lump sum payouts to your client, and they can choose either a $5,000 or $10,000 critical accident rider. I will tell you it's very inexpensive. That's why I like it. I have a hospital indemnity plan with the same critical accident rider on it. It's a $10,000 rider that I have, and it's $1.87 a month for me to have this rider. So very affordable rider, some nice coverage for your clients if they're getting up there in age. Return of premium rider. This is one that if you have this rider and the policyholder dies before reaching the age of 86, the beneficiary will get all of the premiums paid to GTL less any claims paid. Now, I'm going to throw out something here because I'm super transparent. And if you work with me, you know I just tell it how it is. I'm not the hugest fan of the return of premium rider if you have clients that are going to really be using the prescription benefit a lot, because those prescription benefits that they get from GTL are considered claim benefits, and those are going to be reduced against a return of premium payout later on. So kind of keep that in mind, but the rider's there. If it's beneficial for your client, great. Just kind of keep that in mind. Now, something before I leave this page, and we're just about all done here, the premium rates for the ambulance rider, the critical accident rider, and the return of premium rider, these do not increase as your client ages. So once they buy it, whatever that rate prices out to be, that's going to be their rate. Now, when you write business with GTL, it's fun. You use GTL eApp either on your smartphone or your tablet, Android or Apple. It's very easy. Once you download the app, you open it the first time, you put in your GTL agent code, you create your own username and password, you check the boxes for what states you work in, and from then on out, you never have to remember your GTL agent code again, and it's only going to show you the products that are available in the states you work in. You can cross-sell on this platform. It's very simple. And it's so simple that we actually did create a couple short videos on how to use it, but I'm not sure anyone's really ever looking at them. It's so intuitive and easy to use. It's just very good to go. So you could sell a short-term home health care plan and click a button to add a cancer plan or an accident plan. And the nice thing is once you click submit, there's no underwriting on this product. So it's going to be instantly underwritten, issued. And as I mentioned earlier, you probably won't make it to your car by the time that the policy is issued. So I just want to mention before we take some questions that, you know, obviously we still do take paper applications at GTL, but we try to make it fast. So you can mail them if you like, but you can also fax them right to underwriting, scan, email them right to underwriting. Those applications get processed in 2 to 3 days with no problem. So the electronic platforms work great, but we still do have papers. And if you're not contracted yet with GTL, you certainly are going to do that through Premier. But I just want to let you know, once we get your contracting paperwork, we will have your agent code to you in 24 hours or less. So, you know, we do things very efficiently at GTL. So if you need anything, you can call Premier. But if you need anything like supplies, questions on how to use the e-app, maybe some specific questions on the product, you can always call GTL sales support at 800-323-6907, or you can email them at agency@gtlic.com. So, Katie, why don't we see if we have some questions, and we'll play Stump the GTL Sales Guy.
Okay, if anybody has any questions, you're welcome to type them in now, or if you are, I don't see any right now. I think we've handled them, Greg. I don't see a whole lot. You must have done a great job to explain everything.
Something I should mention too, maybe while somebody's typing in a question, is so every once in a while I get, well, who can do this home health care? Who can do this home health care aid? And you know, as long as the person who's doing the home health care or the home health care aid services is certified or registered in their state, whatever those registrations are for that particular state, and they work for an agency or service that can provide a proof of service bill, that'll work fine.
Okay, one question we have here is, will we be sending out the presentation? And Carol, yes, we will. I'm actually going to send you over some additional information as well. So as soon as we have the recording ready, and I'm going to check with Greg and see if whatever things he wants to send out marketing-wise.
Yeah, absolutely. Katie, I definitely want to send you the link to the consumer video and also to the infographic. You know, the link is something that when you click it, I mean, if you guys have a website and you want to put the link on there, that works fine. It's not a video that you'll be able to download and put on your device. The only reason we do that is because we actually do update this video more often than you would think, and we just always want to make sure clients are seeing the latest version. Yeah, I'll get the link to you, and even when we update the video in the future, that link is still going to work. So I'll get that to you today, and you can forward that out to everyone.
Perfect. Diane is asking, will we send our contact information so they can order flyers? Absolutely. I will send my information out, and like I said, you're always welcome to, we welcome you to call Premier for anything you're going to need. But if you get a hold of Greg and something happens that way too, I mean, we all kind of keep in touch here. And it says, can you attach that flyer to the email? So I think we just handled that. I think we're going to attach a copy, but if you did want them customized once you're appointed, we're happy to customize them as well for you. I know that that's a big seller with a lot of our agents. They just love having that right in their briefcase. How about issue ages?
Yeah, age 40 to 85. And then once they have it, they can keep it for as long as they like.
Perfect. Perfect. Also, state availability, I'm actually going to attach that as well. So you'll have a list of any, in case you are holding on resident licenses, I can absolutely send those to you.
Yeah, and with regard to state availability, we probably are, if we get another state or so, maybe, but I think we're pretty much maxed out on the states that we have. The states that we do not have, they have some guidelines with regard to short-term care, or, I should just say a lot of them want us to follow the guidelines of a long-term care policy with the short-term care plan, and that's not something we're interested in. So I would say we're pretty much maxed out on our state approvals.
Perfect. Here's another one that says, how do we get contracted? Diane, I'm actually going to send out everything, so if it is something you're interested in, we can get you that. The question for you, Greg, is, are there different contracts? So if they're already contracted for some other products, can they simply add this product, or is that something separate?
Oh, that's actually a great question. If you already have a GTL agent code and you're set up through Premier and you're selling, let's say, our hospital indemnity plan, you can absolutely just start selling the short-term home health care plan and, or any other GTL product. We will always reach out to Premier if we need anything with regard to commission rates and stuff like that for you. But yeah, you could just start using your GTL agent code that you have and sell away. Perfect.
I'm already getting notes in here that says, please send me the contract, Greg. So I think you did a great job explaining. Are there any other questions out there? Or if there are, anything else we can think that we need to add? I'm just looking. Well, Greg, I think that we've handled it. Thank you for everybody that has sent something in. I will be sending out the copies of the presentation, the marketing materials, and then to the people that just sent me their emails, I will be sending you the contracts as well.
Sounds great. I'll get you those emails. I'll get you those links in just a couple minutes, Katie. And thanks everybody for tuning in. Appreciate you thinking of GTL and taking the time to learn a little bit about our products. Everything that I mentioned today is exactly the experience you will have. And feel free to reach out to me if you ever have any questions too.
Perfect. Thanks again, Greg. Thanks for everybody who attended. I appreciate it, and we will be in touch with you. Have a great day, guys.
Take care.